Hello, my name is Cynthia Okoje, and today my presentation is based on antidepressants and EKG monitoring. Antidepressants carry the risk of QT prolongation, which can be very, very lethal to the patient, especially a patient with a risk factor. Long-term EKG monitoring is important for prevention of cardiac-related issues. EKG monitoring is achievable through remote monitoring by the use of cardiac devices and loop recorders. EKG monitoring benefits patients in minimizing the risk of QT prolongation. EKG should be obtained at the time of initiation of antidepressants so as to confront the issue of prolonged QT syndrome. QT prolongation has a lot of risk factors, and thus the need to evaluate potential chances of QT prolongation when dealing with antidepressants. There are existing discrepancies in the process of monitoring QT prolongation in patients, and therefore, healthcare providers should learn to avoid these errors by avoiding prescribing drugs to patients that have known risk factors of triggering QT prolongation. Risk factors of QT prolongation. The available evidence suggests that additional risk factors must be present before drug-induced QT prolongation occurs. According to Brusco and Stancio, 2017, APA guidelines mandate for termination of antipsychotics in the case where the QTC measures are above the proposed baseline. The risk factors of QT prolongation are divided into three sections, which include genetic factors, medication factors, and individual dependent factors. Genetic factors include congenital long QT syndrome, family history of sudden death, history of previous drug-induced QT prolongation. Medication factors include overdose or high drug concentration, use of QT prolonging medicine, use of medicine that inhibits metabolism, and medicine that cause electrolyte abnormalities. Individual dependent factors include gender, age, structural heart disease, renal or hepatic disease, starvation, or obesity. EKG monitoring in patients. Patients with prolonged QTC intervals are prone to torsades de pointes. EKG monitoring is essential for tracking increase in dose or overdose of QTC prolonging drugs. EKG reduces unfavorable outcomes such as sudden deaths. EKG monitoring involves regular intervals of mitigating the associated risks of QTC prolongation. EKG monitoring of patients minimizes the risk of patients developing torsades de pointes, which is a fatal form of arrhythmia that comes along as a result of prolonged QTC interval. EKG monitoring reduces unfavorable conditions and therefore the need for active participation of pharmacists in the evaluation of QT prolongation in patients, as well as timely dosage change recommendations. It also involves electrolyte monitoring at higher intervals to mitigate the risk associated with QTC prolongation. Impact of antipsychotics and antidepressants on QT prolongation. Antipsychotics and antidepressants have some impact on QT interval prolongation. Researchers assert the influence of drugs on the varying degree of QT prolongation. Though there exists inadequate evidence on the association of QT prolongation with drugs, 75% of torsades de pointes cases are as a result of medication involvement. Impact on pharmacist intervention on EKG monitoring. Monitoring protocols for patients captures and prevents the fatal side effects of prolonged QT intervals. Pharmacist intervention improves rate of EKG monitoring in patients at risk for medication-induced QT interval prolongation. Institutions could benefit from pharmacist intervention in monitoring patients for medication-induced QT interval prolongation. This will be more applicable to patients in an inpatient setting or a hospital setting who are on antidepressants that can prolong QT. Impact of antidepressants on QT prolongation. The elderly are at the highest risk of having QT prolongation due to antidepressants medications. SSRIs cause sudden deaths, while tricyclic antidepressants raise the risk factors. At the same time, women have higher risk of developing torsades de pointes than men. However, researchers should carry out further studies on the effects of antidepressants on patients. Recommendations for potential implementation. Monitoring is necessary throughout the treatment. Regular checking of patients' QT interval by checking an initial baseline EKG and electrolyte panel is very essential. Patients with risk factors should be monitored with EKG and electrolyte panel every month. Discontinuation of medication for QT intervals above 500 milliseconds. Therapy modification for intervals between 470 to 500 milliseconds in male and 480 to 500 milliseconds in females. Implication of praxis. EKG tests should be an essential part for treatment of patients on antidepressants. Sustained episodes or unstable patients require DC cardioversion. If QT prolongation occurs, the medication should be stopped unless there are compelling reasons to continue. Bosco and Stancio 2017. Investigations for congenital lung QT syndrome may be appropriate, particularly if the QTC fails to normalize after the medicine is continued. Thus, this is why regular monitoring is very essential to be able to catch any abnormalities in the heart rhythm of the patient and intervene speedily. And here are the references used for this presentation. And more references. Thank you very much for listening to this presentation.